First of all, what is BHRT? And two, what are the types of symptoms and things that people would come to you to get fixed using this therapy?
So BHRT is Bioidentical Hormone Replacement Therapy.
Okay.
And it is a therapy, hormones, which does include progesterone, estradiol, and testosterone. For the males, I typically only include testosterone with them. For females, you can include the progesterone, estradiol, along with the testosterone. So BHRT, it's bioidentical, which it's more closely mimics your own hormones that our body is unfortunately not producing at the accurate level. And that is why we're having the symptoms that when they come into the office, patients, a female will say, lacking a little bit of energy, decreased cognition, possibly a little bit of brain fog, decrease in lean muscle mass, just stamina is decreased, low libido, and then that is more the testosterone for females deficiency.
Okay.
And then along with the estradiol deficiency, you will see other irritability, midsection weight gain, along with possibly vaginal dryness and irritability as well too.
What about guys? If a guy is a candidate for BHRT, what types of things do they come and talk to you about?
So it varies from individual, but a lot of the men will say, Nicole, it's not about libido. My sex drive is okay. It's more about the stamina. When I come home from working my 8-hour shift, I hit the couch and I am ready for bed after dinner. I have no drive in going to my son's baseball game or soccer game, or I'm just exhausted. So a lot of patients will also say, men will say, decrease in lean muscle mass as well too. And once again, decrease in cognition. And I've also had patients, many of them, say a lot of joint pain as well too when their testosterone levels are low. So hormones trump just about everything in the human body except for the beating heart. But they really do. They really have such a draw and such a pull on how we live our lives. So if you're having any of those symptoms, I highly suggest that you get evaluated and have some labs done to find out exactly where you're deficient.
Cool. Thanks.